Nurses play a key role as the vessels of healthcare delivery worldwide. As we mark International Nurses Day today, we honor and acknowledge them. For more, we speak to the CEO of the International Council of Nurses, Howard Catton, who is joining us now via Zoom. Howard, good morning and thank you so much for making time for us. Tell us about the importance of this day.
Good morning to you and happy International Nurses Day to nurses right the way around the world. This day marks the 200th anniversary of the birth of Florence Nightingale. And as you say, it's a day to recognise, to celebrate, to thank nurses around the world for the incredible service that they give. But it has an extra poignancy, I think, this year. It's, over 170 years since Florence Nightingale came to prominence in the Crimea. We still see conflict now in that region, but in other parts of the world as well, where nurses are putting themselves at great personal risk in very difficult, challenging situations in conflict zones as well, to ensure access to healthcare for people. And on top of that, we know that millions of nurses around the world are suffering the consequences of having carried us through the pandemic, the huge mental health and physical toll that it's taken on them as well as celebrating nurses everywhere today and thanking them. I think that governments also need to commit to do much, much better by our nurses.
Yeah, and actually what we saw here in South Africa during the public sector strike concerns that have been raised, including by nurses as well, that in terms of the compensation, they believe that they're not being compensated enough. And of course, such a critical service that they are delivering. And you just spoke now about the work that they've done during COVID-19, when most of us, the entire world, didn't know about the dangers of this virus, which was COVID at the time.
The situation you have in South Africa with nurses having been in dispute about their pay and the conditions, it's reflected right the way around the world. During the pandemic, government said to nurses, health workers, you are the most important people, and they were. But now when it comes to recognising and rewarding those nurses, ensuring that they have decent pay and working conditions, suddenly government's saying, we can't afford to do this. And the nurses are saying it's not just a question about fairness and the right thing for nurses. We have a huge global shortage of nurses. We have nurses leaving in their droves because of the mental health, the physical pressures that they've done as well. The World Health Organization has recently said that the global health emergency is over. What I think the real global health emergency that we have right now is the nursing shortage. And governments have to invest in that, because if we don't have nurses, we don't have health. Our future health of the planet, of our countries, is intimately intertwined with the future health and well-being of our nursing workforce. And that's why our theme for this day is Our Nurses, Our Future.
Then there's also this question around the critical skills in relation to nursing, and you speak about globally as well, that this is an important conversation. The other aspect is around whether developed countries, which of course, if you look at the GDP, would be able to pay much more for these nurses, should actually be recruiting from developing countries which are in dire need of these critical skills.
This is a really, really critical issue. We are seeing an increase, a very significant increase in the international recruitment of nurses. But when you look closely, it's probably about 7 or 8 high-income countries who haven't educated enough of their own nurses, who are recruiting from lower middle-income countries who can least afford to lose their nurses. There needs to be, those high-income countries need to do much, much more to support, to give back, to compensate from those countries that they are recruiting nurses from. But there's an underlying message for all countries. They need to invest more in their nursing workforce. And this is, I see this time and time again, it seems to be a real sticking point for governments who say we have other priorities, we can't afford to invest in nursing. And I say to them, if you just look at the costs of not having enough nurses, the absenteeism, the sickness, the costs of having to recruit from overseas, the cost of it runs into the pandemic cost the world trillions. You then look at the costs of people not getting access to healthcare, unmet need, the backlog, the waiting times. Those health conditions get worse and become more expensive in the long term. And then finally, all countries who are striving and working towards economic growth, prosperity and recovery, they need a healthy, productive workforce. So this investment in nursing, investment in health is critical to economic growth and recovery as well. So there is an overwhelming health case to invest in nursing. I believe there's also an overwhelming economic case as well.
What do you think the GDP percentage of contribution should be going to healthcare, considering how important it is? And you know, a lot of times when we speak, for instance, about wars and we speak about NATO as an example, and the recommendation is that NATO member states must contribute 2% of their GDP towards their national defense forces and so forth. What should the conversation be when it comes to healthcare, considering how important healthcare is?
Well, firstly, I think you make a really significant point think about spending on health like security, like your national security, because if health collapses, as we saw during the pandemic, you know, it's a bit like a pack of cards that our way of life, about going about things, as well as our economies, all start to tumble down as well. So framing the conversation in terms of safety and security of your country, I think, is a really important point to make. In terms of how much, it will vary from country to country. It's probably in a range of about 5 to 10%. But as well as the spending that goes in, often we see the spending going on particular services and facilities and equipment. Of course, they're important, but none of that works. None of that delivers healthcare without our healthcare workforce. And what we often see is this shyness about investment in the healthcare workforce. Do you know about half the countries of the world, according to the World Health Organization, don't even have a workforce plan in place. It's setting out how many health workers they need to educate and have in their health systems in order to meet their population needs as well. And the final thing I'd say on this as well is that we often fall foul of the political cycle, that you might think that there's a political commitment and then there are elections, things changes and they're put to one side. We need a longer term plan and we need a longer term commitment to health. It takes 3 years to educate a nurse, longer for others as well. We need to put plans in place which are going to stay in place and that all politicians are committed to.
Howard, thank you so much for your time. That was the CEO of the International Council of Nurses, Howard Catton, on International Nurses Day, which is today.